Okay, so we are here with Dr. Rush, who's going to talk to us about making sense of a psychological evaluation. Um, so go ahead, Dr. Rush, and tell us a little bit about yourself.
Thank you, Deide. I am Dr. LaRonta Rush. I'm a licensed psychologist in Georgia, with practices in Dunwoody and Tucker, Georgia. And we do lots of psychological testing, psychoeducational testing, and I just wanted to talk a little bit about that today. Why, first of all, what they are, why they might be helpful, and what you can get from them in order to help your learner. So psychological testing is essentially psychological testing and psychoeducational testing. This is sometimes referred to as psychological evaluation or assessment. These terms are used interchangeably. But they both use a set of techniques, to formal and informal, to arrive at some sort of hypothesis about a child or an adult's ability to learn, about their behavioral patterns, emotional health, personality, mental status, for the purposes of making recommendations for further treatment or accommodations. And so we do both psychological testing and psychoeducational testing. Psychological testing, the focus is on medical issues. For example, you're wanting an evaluation to determine if you have an attention deficit disorder, ADHD, or depression, or a bipolar disorder. So you are really interested in your psychological health, psychological functioning, and the recommendations that will come out of this type of evaluation will mostly be related to some sort of follow-up treatment, whether it's psychological counseling or psychotropic medication. Whereas psychoeducational testing, the purpose of the testing is to understand about learning strengths and weaknesses. And so usually when a referral is related to assessing for dyslexia or a learning disability, dysgraphia, they're not performing well in school, those are usually psychoeducational testing requests that will have implications for accommodations in the school environment or college. Feel free to stop me at any time if you have questions. So I will be using psychological testing, psychoeducational testing, all interchangeably for this presentation. The psychological testing is helpful for a number of different reasons. One, there's usually a diagnosis, and that diagnosis allows us to identify strengths and weaknesses, so strengths to capitalize on in the individual, as well as areas that might need support so that they don't continue to block or impede progress. It often, and we'll go through the sections of what's included in a psychological evaluation, but learning strengths and weaknesses, or the learning style, this gives information about how the child learns this, how they get information in and hold on to that information. Learning strengths and weaknesses will give us information just on why they might be struggling in any particular area. And it also might suggest some study skills approaches, particularly if someone is a better visual learner versus an auditory learner. School accommodations, this process of psychological testing often guides the accommodations or recommendations for accommodations. So if someone turns out through the strengths and weaknesses learned from a psychological evaluation, there are problems with motor skills or handwriting, then they might be eligible for an accommodation of using word processing software or word processing tools in order to make that process a lot better for them. There's also treatment and intervention. As I stated earlier, particularly with the psychological evaluations, sometimes pediatricians or other doctors will refer for a psychological evaluation if they're medicating based on symptoms, but they would like to confirm a diagnosis. Or, you know, someone's been medicated for 2 or 3 years, they're not improving, they're still seeing symptoms, there might be coexisting conditions that are not accounted for, and so a psychological evaluation can help tease out those issues. The testing process consists of an initial meeting, and this is not always the case. And sometimes I will have an initial meeting if the referral concern is related to autism and I want to do an observation, or I want to better plan the type of evaluation I need to do. And this is usually about an hour. And it also allows me to determine the extent of the testing that's needed. So my evaluations are specific to the individual and their needs. If they just want to know if they have ADHD because they're not doing well on their job, but they don't need any academic testing, then I don't have to do academic testing. But evaluations generally last anywhere from 4 to 8 hours of face-to-face testing. This includes a 1.5 hour feedback with the parents or the individual to interpret the results, go over the results, to discuss referrals and recommendations and accommodations. If it's a psychological evaluation, it's usually less than 1.5 hours. But you also obtain a thorough report that summarizes the findings of the evaluation. And we talk about any follow-up. Sometimes the evaluation is not conclusive because there are other things that need to be ruled out, maybe medical things. So we talk about how we will follow up and what time frame that should take.
Can I ask a question about the testing? What I've heard from some parents is that they've seen a wide range of practices as far as whether you do those 4 to 8 hours in one sitting or you kind of break it up. What is your thought on that?
Now, we don't do any more than 4 hours at a time, and so we will generally do 2 4-hour days. And usually in the morning, because you're doing lots of testing of memory and attention, and you really want to be alert and focused, as focused as possible.
Yeah. Okay.
Okay, good question. So there are several components that go into a psychological evaluation. You want to get developmental information. You want to determine if there were any abnormalities in utero. Was there drug use? You want to get as much information as possible about any complications after birth delivery. Milestones, where there are delays, oftentimes with autism spectrum disorders, they have delays in language and medical history, sometimes medical issues, metabolic issues, or thyroid issues. A number of medical concerns can mimic psychiatric conditions. Behavioral history. It's really important, and we get this information not only from rating scales, but the rating scales are pretty current. So when a parent is completing rating scales, they're rating on the child's current behavior. But a parent interview can give more historical information. Is the child, angry, aggressive, throwing things all of a sudden? Or is this something that's been going on for 2 or 3 years? If it's all of a sudden, then that might suggest that there's a reaction to some sort of immediate stressor that would need to be ruled out. It just gives some information about context and onset and duration of symptoms. Particularly for learning issues, you want a really detailed school history. You want some indication, if it's a high school student or middle school student who has a learning disability, that there was some struggles with this particular area, early on. And maybe they didn't fail because they're bright, but there was just some uneven development or even interest in one particular academic subject over another. And then you might also see these differences in skills reflected in report cards or progress reports or even standardized test scores. And so I analyze all of this information because it's all very, very valuable, as well as other test results that have been done in the past. If it's an initial evaluation for someone, this is just a snapshot in time. If they do have previous evaluations, this allows us to see a bigger picture because we can see where they are now versus where they were.
Can I ask a question?
Yes.
Oh, sorry. If someone does have issues during the pregnancy or at birth, can that rule out diagnosing a learning disability like dyslexia if you can't determine if it's because of those issues or also a learning disability, or, you know?
Well, and it's just a piece of the puzzle, because if there was something that happened, you know, in utero or after birth that caused learning weaknesses, then there would be weaknesses across the board, you would expect. It wouldn't necessarily result in a learning disability and reading profile. So what you might see is more pervasive weaknesses and just cognitive functioning overall. But I have an example at the end. There's strengths in certain areas with learning disabilities, and then there's weaknesses. So they're lagging behind in some areas. And so I think you'd see more global impact if it was something that was more related to birth issue development. Yeah.
That makes a lot of sense. Yeah.
I also have a question kind of related to that. Does that affect treatment for things like ADHD, having the, you know, drug issues or whatnot from before birth?
I think it can. I don't think it necessarily has to. It just depends on the severity of their functioning now. It also depends on the environment from birth to now. I think it really depends. It doesn't have to, but I would think in some ways it's going to impact them somewhat. But I think the prognosis probably would depend on just environmental, you know, natural, genetic, and other factors as well.
Thank you.
Okay. Behavioral observations are very, very important. We make observations on everything. Just if a kid is emotional when they have to write, if they have extremely strong verbal skills, this really advanced vocabulary, but you have them write something and they use the most simple vocabulary. And so, or we look at level of activity. If they are crawling under the table and cannot sit down, and you're constantly having to slide things off of your desk out of their reach, it's all very important, because the testing setting is often one-on-one, and it's a smaller setting. So in a sense, it really should maximize attention, and there's a lot of redirection that can be given. And so if they're still struggling in that setting, that's clinically meaningful. Okay. So here's also what's involved in the psychological evaluation, in addition to the background information and the informal information that's collected. We look at intellectual ability. Intellectual ability is usually derived from IQ tests. One of the primary IQ tests that we give is the Wechsler scales. It depends on your age, but from 6 to 16 is the Wechsler scale here, which contains different areas of functioning. This provides information on one's expected performance. Okay, what is, you know, a child's potential, for example? What should we be expecting of him or her? And so we're looking at things like verbal reasoning, ability to reason with verbal information, to retrieve words, to express yourself effectively, fluid reasoning skills. So we're looking for this, you know, how you reason with information that cannot be, when you're working with things that cannot be solved automatically. So you have to learn to identify and apply rules. Visual spatial reasoning and working memory, your ability to, and we'll go over these specifically, recall and give information back in a short amount of time, and then how fast you process information. Okay, if there's uneven development in these skill areas, that gives us information about how one learns or is taking in information. And it also allows us to make more informed accommodations.
Are there different types of IQ testing that you would give to someone who is basically not a reader at all?
No, I would probably give the
You still give the
same
one?
IQ test, yes, because this is looking at aptitude. There's not a lot of reading involved. There's questions and answer, and so they have to answer questions. They are looking at shapes and figures and figuring out missing pieces and patterns or understanding part-whole relationships. But this would not really affect a poor reader. They are just as easily able to perform in the exceptional range as someone who is a good reader. Okay. We will use a different IQ test if someone is nonverbal, for example, or if they have really severe language issues and you believe that their ability to understand and use spoken words is going to impact their intellectual functioning or the expression of their intellectual functioning, we might give a nonverbal IQ test.
Okay, thank you.
So achievement is another area that's assessed, and this allows us to see if there's any sort of difference in the relationship between their achievement and their potential. So if you are of above average intellectual functioning, then you should be above average in terms of your academic skills in reading, writing, math. If there's some lag in development coupled with a family history perhaps of dyslexia or reading difficulty, in addition to my teacher questionnaires, which will say they love math, excel at math, but can't get her to read. She will not read. She struggles over words. And so you're seeing from different sources of information just some difficulty or discrepancies in what they're capable of doing and what actually happens when they're actually executing these academic skills. So we're looking at basic word reading, nonsense word decoding, comprehension. We're listening to them read out loud, reading fluency, which is how fast and efficient they are at reading. Reading accuracy, kids with dyslexia often are very inaccurate in their read. They might skip lines or skip over words and substitute sort of non-essential words, substituting like the for a. And when they do that, it doesn't necessarily have a really big impact on their comprehension, but sometimes it does, particularly if they're also very slow readers and need to decode every other word. Spelling, we look at spelling patterns, knowledge of common spelling rules, written expression skills, and this is just basic sentence writing, but also how they organize their ideas in writing and use punctuation and capitalization and tend to all of those things as they're writing. And then math, we want to look at the basic calculation, math fluency, calculation skills, but also the understanding of just math concepts. Okay. So cognitive processing. So this is the section of the evaluation that I find most helpful, and I think that parents find most helpful also. It's often the area that really identifies why they might be having so much difficulty in the academic area. So it's about looking at processing strengths and weaknesses within these areas or these domains, because it tells us how the child or adult thinks, how they reason, do they think abstractly, their ability to think abstractly, solve problems, generate information from something they've learned to a broader sort of application of that information. How they transfer information from short-term memory to long-term memory for later access. Or they might have the information, but how do they apply the information? Maybe they are they have difficulty applying that information in written format because of some sort of motor skill weaknesses or speed issue, but they're better able to do that in a verbal format. So this section is very informative, to me as I make diagnostic decisions, and I think also for parents. So I'd like to see if I could move this up here. Okay. So I'm going to just talk about a few of these specifically, the different areas of cognitive processing and what that includes and what you might see when someone is struggling in this area. So if I see weaknesses in testing and it's not just one score. They're looking for patterns. And so if they have weaknesses in this area, this is what they typically look like in the class, or what they might have difficulty with. So motor and visual motor integration. So this includes, fine motor coordination. So these kids, we're basically looking at speed of which they're completing written work or anything that involves fine motor skills. Gross coordination, so this is participation in sports and throwing things and walking, their gait, all of that. Motor planning, the ability to sequence steps, and you need this for solving math problems. And so this is, you'll see lots of weaknesses in the writing and math area with visual motor weaknesses. So these kids might have poor handwriting. The quality of their written work is very poor. It's sloppy. They might write in the margins. They can't stay in the lines. They are solving math problems and they don't have enough space. Note-taking is really hard sometimes as well, because they either can't write fast enough or they can't read their notes. They just really can't tell you what it says. Or executive functioning, sort of comes into this as well. So, you're having to organize. You need organization for writing or lining up problems in math. So sometimes we recommend that these students be allowed to, whenever possible, type or learn typing skills, have note-taking assistants, or be able to audio record the lectures as they progress in school for high schoolers. Or there are all sorts of tools that you can use for writing, such as talk to text or Dragon, that will make this process easier. Or if you're younger and you have to write, raised line paper, or using those little handwriting tools, pencil grips. So this really guides the recommendations if we are seeing a kid who has lots of weaknesses in this area.
Would you also suspect that there could be something going on with their vision if they show these types of issues?
Right. Very good question. So it's visual motor integration. And so if we do measures that look at both visual and motor, and tasks that look at just motor, that don't require visual processing or discrimination in any way, and those that are more visual processing and you can perform the task with your hands behind your back. And so it's just, there's no motor, we're just looking at vision. And so if you see that they're both low, then that may be problematic, but then you'd also expect them to perform poorly on other measures where visual discrimination and perceiving things accurately with the eye to be low as well.
So you just kind of compare different testing results and kind of see, is this a global vision issue, or is this just
just specific to this task? Okay. And if it is, because if they did really well on this measure that required visual discrimination, but this one also requires it, but they did pretty well, then what could be the difference? Oh, this one was also timed and it required visual discrimination. And it also had a motor component. And so we look for those differences and try to make the connections.
Okay.
Processing speed. And you can have kids in the gifted range. I mean, as bright as can be, but they might need time to process and respond to information. They may need more time than their same age peers to perform up to the level that they can. And they're accurate usually, but they're just very slow. And this has really pervasive impacts across all academic areas. So this list is not even exhaustive in any way, but this can include psychomotor speed. So you can be very slow at tasks that are requiring a motor response, or those that are verbal. And so are you slow at both? You might be slower on routine tasks or more complex tasks. Sometimes kids are really fast as long as they don't have to pull up previously learned information or math facts or anything that makes the task more complex. They might sacrifice speed for accuracy and increase time to sort of think through these things. And so attention and focus, how fast you process something, is going to depend on if you're sustaining attention and focus throughout the entire task, or are you wandering off and daydreaming, you know, every 4 or 5 seconds. And it could be the reason for slow processing speed can be either one of these. It does not, you know, so that's why it's important to sort of tease out and understand, you know, the underlying reasons for the processing speed weaknesses. This can impact, if it is true global weaknesses in processing speed, I typically see anything that's timed, they're slow. And so that's when you usually see the most pervasive weaknesses, which means they will read slow, they will calculate slow, they will write slow, they will respond to you slowly if you ask them a question. They will be slow moving and slow to get started on things. And so you will, we will make accommodations just based on all of these areas and just the global impact that it could have. Any questions? Language, big one. This is really like super huge topic to even cover everything, but language is so important, and it's receptive and it's expressive. Receptive language skills are everything, just basically your understanding of information at the basic vocabulary level, but also your understanding of higher level discourse and your understanding of even just nuance, humor, or what someone means rather than what they say. You know, I'm going to catch you later. You know, you don't literally mean catch you, or so it's just so complex of a construct, and it means everything for a kid's ability to understand what their teacher is saying, to express themselves in conversation. It has implications for social skills. Social skills are largely language, and you know, and you're going back and forth and talking about things of interest, and so it's also the basic phonological aspects of language, which is your phonological processing, your ability to understand sounds, individual sounds, and words, and hear those sounds. Verbal fluency, you know, how fast you can, you know, sort of express yourself, your fluent abilities or fluency abilities. So this is important, and kids who have issues here might have difficulty with vocabulary or poor vocabulary, and it impacts their listening because there's more of a likelihood that the teacher or the information that they're listening to is going to contain vocabulary that they have not heard before, they have not been previously exposed, and so it's going to disrupt the comprehension somewhat. And the same for vocabulary that's in written material. Difficulty with oral expression and retrieving appropriate words to express yourself. This will impact writing, and this is where I mean you can have a kid who's extremely bright, but you get writing and it's like this big. It is certainly not reflective of what they're capable of. Poor ability to identify vocabulary in math and math word problems and what that means, not following directions and being confused by directions. And so I make observations here when testing. If I hear a kid answer a question that has absolutely no relationship to what I just asked them, or if they say huh a lot, or huh, or what was that? I don't understand what you mean. And so there's just a lot of qualitative information that you can understand from language as well. Memory and learning. This essentially involves the ability to store and recall information. And it includes long-term memory, short-term memory, working memory, visual memory, auditory memory. Working memory, you're essentially just storing information while you're performing a task. So you are, if I give you a phone number, what process are you using to remember that phone number until you can get to your car and input the numbers into your phone to make that phone call? Some people use verbal rehearsal. They repeat the number over and over again. But if the number is too long, it exceeds your capacity, and you might need to use another strategy like chunking the numbers in some sort of way. and short-term memory, ability to call information after a few seconds. Again, we studied this and look at this by long stories. If the information is too long, is that more of a problem for you? And so we need to break up information and not give too much information at once. Or are you more impacted if the information is meaningful versus non-meaningful? So you really can't understand a list of words, you can't make sense of it, it's not meaningful enough to you. But you do really well if I'm telling you a story that's contextual, it's meaningful, it has a beginning, a middle, and an end, and it makes sense in that way for you. And long-term memory and retrieval is this ability to store information for later use. And so you are essentially transferring this information from short-term memory to long-term memory and you're going to use it next week when you have a test, for example, a history test or a science test. But memory is interesting because long-term memory is recall, but it's also retrieval. So even if you do have the information up here, it really matters how the teacher is accessing the learning. So if it is by spontaneous, you're taking an essay test, a kid might not do as well, but if I give you a multiple choice test and you know every single answer, then maybe there's a retrieval issue. It's in there, you're having trouble getting it out. And with these kids, you might hear a lot of, it's on the tip of my tongue, I can't think about it. I know what it is, I just learned that, but I just can't, so it is in there, they just need these cues to retrieve the information.
That's pretty common, I think, in kids with dyslexia. Is that just related to the trouble they have with that sort of naming speed, that rapid naming skill?
Yes, it's either slow or it's that slow retrieval, visual verbal retrieval is an issue with dyslexia. And, but long-term memory may or may not be a weakness for someone with dyslexia. Mm-hmm. And so even kids with dyslexia are unique in that they have different patterns of strengths and weaknesses. Mm-hmm. Now, the impact of this, these are your kids that they're going to have problems understanding or remembering multi-step verbal directions. So if you give them 3 things to go get from their room, they're going to get halfway up the stairs and say, wait, what was that? Problems remembering previously learned information. And parents are very frustrated by this when we just went over this. But this is it's a natural weakness. They're not doing it on purpose. Difficulty recalling information right after reading it, and then they have to reread it. And if you don't have accommodations or of extended time, this can be problematic. Not to mention, this area is highly influenced by comorbid ADHD or attention issues, by the way. Mm-hmm. Problems remembering steps or formulas in math, difficulty remembering sounds, words when decoding or recalling spelling rules. So memory and learning impacts a lot of academic areas. Attention, executive functioning. We're not going to go over this a whole lot, but attention is really a prerequisite for most cognitive tasks. If you're not attending, then you didn't get the information in. So therefore, you can't give it back when I'm asking for it, okay? You can't perform a response if you didn't hear it. And it also makes it a little bit difficult to determine if it's a language issue, a memory encoding issue, or an attention issue. So we do lots of testing to sort of tease out these factors because it matters for intervention. Mm-hmm. So tests of attention involve, the ability to focus attention, sustain attention, shift and divide attention, resist distractions during learning and problem solving. Executive functioning includes flexibility. So when you're trying one approach to solving a math problem and that doesn't work, to use another approach, or being flexible in that way. Controlling emotions and not getting upset and throwing your pencil and walking out. Inhibiting more other sort of attractive or preferable tasks in order to get something done that's due tomorrow, and being able to prioritize in that way. So we do assess those things too. And when we see pervasive weaknesses in this area, they're going to be the kids who don't listen They have problems sustaining attention, so they might be highly motivated initially, but they get really tired and very bored very easily. They give up easily, or they lack effort just to get it done. And so in those instances, you might want to make their ability to engage in their preferred task. If you want to play a video game, then you have to complete this, but you can't have any more than two errors. So there you're putting the premium on not just getting it done, but also accuracy. Okay. They have difficulty making transitions between tasks. They have difficulty making transitions between something they want to do and something someone just told them that they now need to do. Time management, they're wasting time. They're doing something that's easier, but it's lower priority. When this larger project is due tomorrow, they don't finish their work, and they really have lots of poor organization. They might overlook details, overlook operation signs. And so this is really one that has a lot of impact academically. And then we also look at emotional and personality functioning. So this area, I cannot underestimate how this area can also really impact children if they are trying to learn when they are depressed or they're highly anxious. And anxiety can come in many different forms. You can be anxious about separating from your parents, or anxious about talking in front of others, or anxious about not being perfect or getting something wrong. I definitely witnessed this one a lot. And we'll see kids very hesitant to give me an answer verbally because of anxiety, because there's an opportunity there for me to judge or evaluate their answers and responses. But when they're doing nonverbal tasks, they're working much more efficiently and they're less anxious. And so sometimes I have to, when I see that pattern, make them feel a little bit more comfortable. You know, this item is really difficult. You know, this test goes all the way up to kids who are 16 years old, and you're just 10. So most people don't know it, but just go ahead and give me a guess. Just try your best. And I usually find that they, with that permission, feel free to go ahead and give their best effort and not be so overly focused on evaluating their performance and their answer. Adjustment to coping with stressors, and this is why the history is so important. If a kid is running around the room, he cannot sit down, he's throwing chairs, he's not focused, he's failing, and then he goes for an evaluation and the psychologist says he has ADHD, but it turns out the parents just divorced and he, had no history of this whatsoever until 1 month after the divorce. That's meaningful because it means that once he copes with stressors and once we recommend therapy and counseling and he's able to deal with this, and the symptoms will go away. And that's not an attention deficit disorder. Behavioral patterns, looking at behavioral patterns in mood. Are they just chronically low, sad, withdrawn, or are there intermittent periods of mania? Would help differentially diagnose a more severe depression or a bipolar disorder, for example. Social relationships, pattern in social relationships. Do they approach social relationships with apprehension and nervousness and self-evaluation? Or are they, do they have poor social relationships because they lack the reciprocity, that's necessary to have that social interchange and to be able to share ideas with others, as you would see in autism spectrum disorders? Or social relationships are problematic because they're angry and aggressive and the conduct interferes with the relationships. And then you also want to assess for any trauma history. So just an example of the graph that I use and putting all of these scores in. It's a lot of testing. And so this example of Sarah is assuming a 2 half-day full comprehensive psychoeducational evaluation. So in this case, full achievement was done in addition to the psychological processing areas. You can see here that in the blue section, the IQ, overall IQ is a 120, which is a really strong score, an average score where most kids Sarah's age, they would perform right there in the average range, 90 to 109. She has really strong verbal skills, really strong working memory. Processing speed is an area of weakness. As we stated earlier, you know, processing speed is low, but this score alone doesn't tell me much. I have to see if this is more of a pervasive processing speed problem, and if it is, I should see weaknesses wherever there is a bold, you know, with the T out to the side, whenever I see measures that are timed, okay? Indicated by the bold print and a T out to the side. And so when I look at reading, you can see here that clearly this kid has very, very strong comprehension, but they're weaker in all the other areas. This is more of a dyslexia profile, okay? So their basic word reading skills and basic decoding skills are poor, and they certainly are unexpectedly low given their potential and what they're capable of doing. And when they're timed, they're at an even greater disadvantage, okay? And you see that process somewhat here in reading, but not so much. It's still above average. Clearly, reading comprehension is a strength, which basically says that although they can't understand every single word, they are filling in the blanks, and they're able to understand and get the gist of the information that they're reading sufficiently for understanding it. But then when you look at their fluency, and fluency assumes speed and accuracy of reading, there are significant weaknesses here with Sarah. So she's going to read slower. Oral reading is going to be marked by mispronunciations and word substitutions, skipping lines. She may or may not even notice the errors that she's making when she's reading. And that's also an observation that I make. I think that's important. Some kids will read and they'll make an error and that just makes no sense in the context of what they're reading. So they stop, check, go back, and try to sound out the word and connect it to something in their vocabulary that does make sense. Sorry. In the area of math, they are performing, you know, right where we would expect them to, given, or Sarah is performing right where we would expect her to, given her intellectual functioning in calculation and in her understanding of conceptual or math concepts, so her conceptual math understanding. So these are also word problems. On this particular test that I give, where it says math reasoning, this 121 she was able to get is based on the examiner reading the math problems to her orally. And so a lot of times I will get a referral concern that, especially at the middle and high school level, that they're failing word problems. They're good at math, but they're not doing well on the word problems. Well, word problems require reading. And if you have dyslexia, one of the recommendations that you absolutely must make, you know, for these kids is to have the word problems read for them, because then that's the difference between a below average score and what Sarah is capable of. When you don't do that, what you are assessing instead of math reasoning is you're assessing reading. And then math fluency, once again, here's another area where the fluency, so these skills, the math fluency skills are significantly weaker than, you know, Sarah's ability to perform these skills in untimed conditions. So for that, we require, or not require, we recommend extended time, which is a pretty standard accommodation. In the writing area, spelling is, of course, impaired with dyslexia. These difficulties in the sort of basic phonological awareness and understanding of sound symbol relationships is reflected in spelling as well. Writing samples, a pattern that I see, it's usually higher because they are able to put concepts together. And first of all, this writing sample subtest, I should say, we're not allowed to take off for spelling errors. And so when you don't take off for spelling and you're just looking at the ideas, you're just looking at their ability to construct sentences, they tend to perform better. And then writing fluency is also lower, which means they are negatively impacted by the time. So I'm getting the sense that the processing speed is more of a global sort of issue rather than something that's just related to attention and focus. Okay.
Yeah, this profile seems like a very common one that I see a lot with our students who do have dyslexia. What would you do? I guess I have a couple questions. From a parent's perspective, they might look at the cognitive ability scores and say, okay, what can I do to increase my child's processing speed? Like, can I target that somehow?
And there's different schools of thought on that. My thinking is that even if you were to increase or to work on processing speed through programs like Learning RX, or work on it through programs or apps like Luminosity, there are things that you can do to sort of practice these skills. I just don't know that there's a lot of generalization to the academic areas that would be sufficient enough. And so to me, the most important thing to do with the processing speed this low is to accommodate it, which is offering extended time. And you can also have extended time in college. It's a pretty common accommodation. But it also tells you a lot about, as an adult in a career, you probably shouldn't take a job that requires quotas and requires you to get a number of things done in 2 hours. It might impact your effectiveness. Or if you do have a job like that, getting an evaluation and asking for accommodations on your job in some way, if that's allowed.
That makes sense. So my other question would be, it seems like schools will do a lot of these same tests, but they won't diagnose from those tests. What would you recommend for a parent who has some testing done through the school, but then they really want to know, does my child have dyslexia? Is there a certain type of intervention they can do?
Right. So the purpose of the role of a school psychologist conducting an evaluation in schools is to determine eligibility for special education services. And so they do not diagnose disabilities. And although they may give very similar measures and they might get a very similar profile, they are not allowed to call it anything diagnostically. They are just able to say, this student, based on this pattern of strengths and weaknesses, they appear to meet the eligibility criteria for a specific learning disability in reading. And therefore, they are entitled to these accommodations, instructional and test accommodations. However, licensed psychologists can make diagnosis even with the same set of scores. So if parents have testing done by the school, I guess what I would do, and other psychologists might have a different way, and I've done this before. I've taken a look at the scores, and just based on the scores, I would say this looks like this particular profile, or it does look like dyslexia. I would not make a diagnosis, sometimes because there's some parts of the evaluation that may or may not make sense to me. They did really well on this, but they didn't on this, but the person didn't explain it, or really interpret what might have happened with an outlier score for some reason. And so I can't really have a lot of confidence in some of the testing, but I can say just based on the information that's there, and even recommend additional testing if I think that would clear up the picture a bit. This section here, you can see language processing. Slower, so language is strong overall here. This is expressive language, this is receptive language. The receptive vocabulary and oral discourse comprehension, long stories, and this ability to understand long stories. all in the exceptional above average range, and the score drops when it's timed, okay? And so we're seeing on both verbal tasks and tasks that require paper, pencil, or motor use, she's equally slow, okay? Phonological processing, again, so the basic fundamentals of language, the phonological awareness skills, rapid naming, the visual verbal retrieval, these make sense and often underlie dyslexia and reading disabilities. And then we also look at verbal memory. Verbal memory for discrete, just a list of words. So I want you to pretend you're going to go shopping, and then you give them a list of words and how many words they're able to recall right after hearing it. So Sarah was able to remember quite a few words after 5 repetitions. You know, she didn't recall, the score was lower, but you know, what we want to see is you recall maybe 5 words the first time you hear it, but with 5 repetitions, your learning increases. You're making cumulative gains in learning. After another trial, again, that initial learning is really, really strong, but she's not hanging on to the information because when I'm looking at her short-term and long-term recall, the scores drop significantly. But then I say, well, some of the words were bugs. Which one of the words were bugs? Or some of the words were animals. Which ones were animals? And then cueing, offering those cues increases her memory. And this is the pattern. This is what I mean by retrieval. So she couldn't give it to me here, but if she didn't have them in there, she wouldn't have been able to give them to me here. But she needed those cues to help jog her memory. Multiple choice, this is where you give a recognition format. Well, was this on the list? Was this on the list? Or what about this one? You'll usually see kids say, oh, yes, 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 I forgot about that one. Yes, that one. And then their score is also increased. So this is an issue. So if you just look at the top short-term and long-term memory, it looks like this person has a retention issue. They cannot remember anything. That's actually not the case. They can't remember it without cues or without you varying the format in which you're accessing their recall. Long-term memory, right after and 30 minutes later, this kid did not have the same issues with retrieval because it was in a story format. Stories are meaningful and they understand information better that way. Meaningful information. So you help kids assign meaning to information that's sort of unfamiliar to them. And we also look at visual memory, their immediate memory, and then when they have to recall it later, again, there's some retrieval problems, but then you give them multiple choice format, they can recognize the information more easily. So with accommodations, you can offer or recommend instructional modifications, you know, in terms of class. So some kids are extremely verbal. Sarah here is extremely verbal and can probably give you the best creative story. Do you really want to make her write out her story? That's not going to allow her to perform to the best of her ability, given her profile. And then the visual spatial motor here, you can see that visual motor together, 111. But when you break them up, we're just looking at visual discrimination. Here, it's not the motor. Motor is fine, but there's something about discriminating differences in visual stimuli. Again, this can cause issues with reading accurately, recognizing the signs in math problems. And so recommendations like highlighting and saying the operation sign out loud before you solve a problem so that you're in the right mindset at the outset. And so this is how the accommodations and recommendations generate. Any questions?
Is that, I know we see a lot with students with dyslexia that they do have difficulty with reading signs in math. Is that?
That's definitely related. Mm-hmm.
Yeah, I wonder.
I see that a lot.
do we know why those things are connected? It's just a recognition of symbols problem?
I think and there probably are various reasons. And again, we also have to consider the whole picture. Is there some comorbid, attention issues, poor attention to detail? But then, of course, just visual symbol. So this symbol of a plus sign, it symbolizes an operation that you need to use. And I think it's the same thing with, you visually look at the symbol and it is that representation. They have not made stable connections or stable representations of these symbols in their head, which is why sort of this letter sound and associating sounds with letters becomes such a difficult thing to master for some kids who have dyslexia.
That makes a lot of sense. Thank you.
So what is next? So using all of the results as a roadmap, and the recommendations could be, many different things. Usually it's all three of these. School accommodations, if there's a diagnosis, of course, school accommodations, many of which I've stated already. Extended time, a common one. This kid gets to use noise canceling headphones and type out his responses. There's also talking your ideas into a tape recorder and maybe using mom as a scribe, or talking to text into your phone and emailing it and editing. Editing is a very strong skill to have. Which words are spelled, it also has spell check, and where do periods go, capitalizing the sentences, and proper nouns. So that's something that I typically recommend. Graph paper, enlarging. If kids have visual motor issues, I often don't like to, or I like to recommend that they don't have too many problems on a page. If processing speed is slow, modify and shorten homework. They shouldn't really be sitting there doing 20 problems if 20 problems takes them 4 hours to do.
May I please ask a question?
Mm-hmm.
What do you think about, and I haven't used them much, only looked in a little bit, but those live scribe pens that do audio?
I love those. So Echo, Live Scribe, there's a couple of different versions where essentially you have a pen, and the ones that I have seen, there's a special notebook that you take notes in, and it has a camera on the pen part, and there's an audio where the eraser would be on the top part of the pen.
Yes.
And you can take notes. And if you miss something particularly important for kids who have language issues and difficulty processing and understanding things fast enough, if you think about note-taking, it just involves so many things: attention, executive functioning, organization, spelling accurately, processing speed. It's really tough if you have weaknesses in these areas. And so this allows you to take notes, and later when you're studying and reading over your notes, you can put your pen on the page, and the audio sort of takes off where you left off, and you can sort of fill in the blanks of your notes.
Do you have a particular, like Echo, what they have so many different, like even in Echo Live Scribe, there's many different types. Do you have one that you would recommend or you like?
I can look into that and send Didy an email about that. Not off the top of my head, but yeah.
Okay, yeah. Thank you.
Mm-hmm. And referrals. This is important. This might be referrals for OT or a speech therapist, a referral for a medical follow-up because there's, the kid kept falling asleep, during the evaluation, or just follow up with the pediatrician for ADHD medication management. So we also make other referrals to other providers if that's indicated. And then treatment recommendations for emotional issues, if there's family. So if it's a divorce and the behavior issues are related to an adjustment disorder, they don't need medication. And that's really important. You don't want to put someone on medication that just needs therapy and family therapy. And so we will refer for that. Or you might need therapy for a severe anxiety disorder. And I try to do some psychoeducation with the parents of when medication might be indicated. And it really is based on the severity of the symptoms and how much they're interfering with the kid's ability to get things done, how much is it affecting their social relationships, their self-esteem. So we do have a conversation around those things as well. Okay, questions?
I imagine as part of your accommodations or suggestions at the end that you also might discuss different school placement options for kids who maybe public school or the particular school they're going to is not the best fit for what their learning profile might be.
Yeah, yeah. I definitely can do that. In a lot of instances, parents are very interested in that. There are some schools, I won't name schools, but there's some schools that might be intolerant to behavioral issues, for example. So if a kid is very severely ADHD and impulsive or aggressive, you know, that a particular school might set them up for failure. Or if a kid is really severely dyslexic and they're at a particular school, this school probably isn't the best school because they are not set up for that. They have less and less support as the kid progresses through the years rather than more support for reading issues. And so a school that specializes and that has OG trained teachers, and that's probably a better school. Or for parents who can't afford private school, talking about the accommodations that they want to have and make sure that their child is getting in a public school. I was a school psychologist. I worked as a school psychologist in schools for years. So I wrote eligibility reports. I wrote psychological reports. I sat in on IEP meetings. And the parents that if you have to send your kid to a private school, your kid can be successful, but you have to advocate for your child. You have to stay on it. You have to make sure that what's being implemented and what's not, and make sure that they are doing exactly what they're supposed to be doing. Because oftentimes, well, I shouldn't say oftentimes, but if you don't, we just won't know and really can't account for the kid's progress.
Yeah, I think that's a very good point. I definitely, having lived in many different states now, I've seen a wide range of support offered at public schools, so it does vary a ton. And unfortunately, just the knowledge level, I think, of school personnel can be very, especially around things like dyslexia, where they don't necessarily have specific programs or specific ideas of how to remediate it in the school.
Right.
You know,
And then that's when we would recommend tutoring
mm-hmm.
outside of the school, because the public school isn't, you know, for example, using OG or has, so what I would just want them to make accommodations, and then I will talk to the parent about how important it is to have private tutoring, and, you know, several times a week even, because that's going to really be helpful in making the most progress in their skills.
Yeah.
Absolutely. Any other questions? Well, my email address is not there. I thought it was there, but I will email you well, you have my email address, and you're free to give me a call. My email address is on the website, though, so you can email me anytime if you have any other questions that come up.
Wonderful. Thank you so much, Dr. Rush. We really appreciate this.
Thank you.
You're welcome.